Many of us plan for retirement, build up our savings, and prepare for medical emergency. But few stop to think about what happens if we become severely disabled for the long term. The truth is, this risk is higher than many of us realize. According to the Ministry of Health, 1 in 2 healthy Singaporeans aged 65 will develop severe disability in their lifetime and may require long-term care. In today's episode, we will explore why long-term disability remains a blind spot in financial planning, what it means for families in Singapore, and the emotional as well as financial challenges it brings. Joining me in this discussion is Ong Hui Ming, CEO of ECON Healthcare Group. Hui Ming, welcome to the DollarsAndSense Podcast.
Yeah, thanks, Timothy. Thanks for having me here.
How does long-term disability look like for patients in Singapore?
So in Singapore, we define long-term disability in terms of the 6 activities of daily living. So for short, we call that the ADL. Right. And when someone can no longer manage, at least 3 out of the 6 ADLs, then they would have long-term disability. Yeah. So for example, ADLs are fundamental and routine care tasks, like bathing, dressing, feeding, toileting, moving around, transferring, for example, from your bed, to the chair, that most healthy people are actually able to perform independently. Yeah. And when someone loses the ability to perform at least 3 out of these 6, then they are actually then requiring ongoing support. And we term that as a long-term disability. So imagine if you're not able to bathe yourself, dress without assistance, or even move from your bed to the chair. These are often things that we take for granted, right? But for someone with long-term disability, they actually become daily struggles.
Yeah. I would assume that for many of these people with this long-term disability, a lot of it will come with old age, just someone becoming much older. But what are some other points or trigger points where someone who otherwise would have been healthy end up becoming long-term disabled and being unable to fulfill some of these ADLs?
So these causes can actually range quite widely, right? For example, from a sudden disabling event, you suffer a stroke, for example, you meet with a car accident. Right, things like that are really unexpected. That may actually lead to long-term disability scenarios.
Do you see situations where people actually recover from some of this long-term disability?
Yeah, we do, right? So depending, right? Even for stroke, there are, people who actually recover from stroke and are able to then regain some independence, after suffering from a certain health condition. Say, for example, if you have to have a surgery, the person may recover over time with good care and rehabilitation, then that will be a short-term, support that you require. But often when you're hit with a degenerative condition, for example, dementia, or Parkinson's, or for example, when you actually suffer from an acute episode of stroke, but the stroke leads to long-term consequences, then the need for support can last for years. It could be really an extended time.
Right, could even be lifelong in some cases, and that's, I think, a very tough situation. So given the impact that it can have in many of our lives, why do you think for many of us that long-term disability is still a blind spot where we may not be thinking about as often as we really should?
Well, I think it's also because as healthy people, we are going about our daily lives, right? And we just don't think about the possibility of a sudden stroke or a sudden health episode or an accident happening to us, and there's also a misconception, that disability only comes with old age. And when we're young and active, it really feels very far-fetched, right? And we tend to take our chances.
I just want to talk about 2 areas of long-term disability. I think according to, the government, even if you are healthy at age 65 as a senior, there is a 1 in 2 chance that you will develop long-term disability still, as you grow older. But there's also these stats that I think the Great Eastern study that I saw, 4 in 10 of Great Eastern CareShield claimees are actually in their 30s. Not many of us realize that, even at the age of 30 or in your 40s, you might start to have some ADLs, which I think is also one of the reasons why the old Elder Shield, which used to start at age 40 onwards, got reduced to age 30 for CareShield Life. Is this something that, in your sector that you see more and more younger people unfortunately needing some of this help with activities of daily living?
Yeah, I mean, in our sector, predominantly, we're also seeing most seniors, but they are actually aged 80, 70 and above, right? But there's actually a prevalent early onset of dementia.
Oh no.
And also based on studies that have also shown, that 1 in 4 stroke patients are actually under the age of 60 years old. The early onset of dementia is worrying, as well as stroke also. With the lifestyles, with stress, whether we are managing our chronic disease well, I think these are also some of the key factors, leading to some of these trends, that we're seeing in Singapore.
And I think when a loved one is severely disabled, the impact on the family isn't just physical, it can also be emotional and financial. I just want to talk about the emotional aspect first, right? What are some common challenges that you see family members facing emotionally when there's someone with long-term disability in their household?
I mean, what we observe is that, many times when our loved ones get hit with a certain health episode, regardless, whether it's our partner, our aged parents, we are often caught unaware. Yeah, and the first thing we want to do is we want to be there for our loved ones and really to step into the role of love, and duty, right? But most often then we will find ourselves like really stretched thin, because being let's say I'm a working professional and I end up being a caregiver, I would have to balance my work, my children, my family responsibilities and round-the-clock care.
Yep.
And if I'm a sandwich generation, then I have to look after 2 sets of parents, and also my kids and my work. Will I be able to perform well at work? Right. But I also feel that sense of guilt, am I spending enough time, looking after someone that I love so much? Right. And it's not easy, I think, day in, day out, really then caring for your loved ones, because you want to try and give the best, So caregiver burnt out and caregiver stress is actually very, very real. And caregivers do need that support. And it's also a hard decision that a family caregiver would have to make as well. Do I bring in help?
Yep.
Yeah. Do I be the primary caregiver myself? Do I give up my job?
Yeah.
Right. My work? Right, and that's a tough decision. And there are family members who actually end up deciding to actually give up work, right, to be a full-time caregiver. Then that's where, as a family unit, right, then you get hit, with the loss of income.
Just want to talk about long-term care in Singapore, right? How do you see most families in Singapore approaching it when they have this challenge, right? Is it, do they need home care, or can a nursing home help as well?
Well, I mean, there are various solutions that are available, in the sector. But first and foremost, family will want to have that flexibility, and solutions that can be tailored to support their caregiving journey, depending on their personal preference and also their loved ones' needs. Yeah, and more families would still prefer to start with home care, honestly, right? And home is always the best place to be. Yeah, and we want to keep our loved ones close to us, right?
Yeah, I think morale-wise as well, right? I every time my parents, if they need to be in the hospital for a few days, my mom just wants to come out as soon as she can.
Yes, yeah. And when my grandma, needed care, and she passed away at 98 years old.
Oh, wow.
Right, yeah, some years ago. But when she needed care, we tried our best to care for her at home.
Yeah.
These options are actually available. So if you have loved ones, who maybe after a period of hospitalization, and they discharge back home, right? You could train up your caregivers.
Okay.
Right? To be caring for the basic, ADLs and all that, right?
Okay.
At home. But sometimes, for example, if you are someone who had suffered from stroke and you do need also a period of rehabilitation, right? So you would then get in a physiotherapist or occupational therapist, to do the in-home therapy.
So they will come to the house.
They'll come to the house, right? Because sometimes if you need to be on wheelchair, and they need a lot of support with commuting, then going down to a outpatient clinic, may not be that convenient. Some families still choose to do that, but if you choose to have more complete in-home care, then these options are actually available. Yeah.
So those are usually for a period of time as they are recovering from their
for
illness.
a period of time, right? So it could be 2 or 3 months. It really depends, on the condition as well. And for family members who then require added support, where you need a trained professional caregiver, to be supporting in the ADLs or programs and various care needs, then you would, bring in home care support, right, to supplement the care at home.
So is it a cost or?
Yeah, so there are actually caregiver training available. For us, we will also provide one-on-one and in-home care. Firstly, we will bring in our occupational therapists, to do a home modification, for example, to do assessment. Is your home safe?
So that you might need to install some safety equipment.
Yeah, so is your home safe? Because you're thinking about the mobility, and the support of your loved ones at home.
Yep.
Yeah, so we'll do a home safety assessment, toileting, do you need your assistive devices, mobility aid, things like that. And depending on the care needs, we could then also custom training for either the foreign domestic helper or family caregiver. Because if you think about it, how do you do the transfer, toileting or showering, the ADL needs for your loved ones, it requires skill.
Right.
Whether you're suffering from right side weakness or left side weakness, things like that. You do need to be trained, on the transferring and care techniques.
At what point do you think realistically nursing homes are required? Yeah. I mean, I know there is an option of, is it like daycare as well?
Yes.
Sometimes?
Yes.
So there is daycare and then you could also be full-time in the nursing home, right?
Yes.
At what point typically do you see patients requiring that level of support?
Yeah, so there are daycare options and senior care center options available in Singapore, right? So typically, when we have a resident who prefer to be cared for within their own homes, then you could consider daycare and senior care centers to supplement the home care. Okay. So that the seniors is actually not, or the patient is actually not at home all the time. You do actually get to get out, and interact with the community. But sometimes when care gets too complex, and you find that the health condition is actually deteriorating, right? Then that's where you may actually really require residential care options like nursing homes.
Okay.
Right? And another factor that we often also see would be then coming from caregiver stress and burnout.
Right.
Because imagine caring for someone at home, you have to then coordinate the medical appointments, the medications top up, the visits to the hospital, stuff like that, right? Then the coordination of care actually could be also quite taxing for the family member. So sometimes, then they would consider nursing homes. Yeah. But in nursing homes, there are long-term options, but there are also respite care options.
Right. Well, I just also obviously want to talk about cost of all these solutions as well, because we know cost is a very real problem, right? So how much the home care or being in a nursing home really costs?
Perhaps let's try and use someone suffering from stroke as an example, right? So, and if the family member is actually considering in-home physiotherapy services, for example, and if you require intensive rehab therapy, say 3 times a week.
Okay.
Right, and on a monthly basis, then the cost could be estimated around 1,000, 1,500.
Okay.
1,500 a month.
So that's about 3 times a week someone comes to the home for a few hours each time, right?
So each time when you have a physio who comes to your home to do the physiotherapy, it would be around 45 to 60 minutes.
Oh, okay.
Yeah. So based on therapy session 3 times a week, the monthly cost could add up to about 1,500. Okay. So that gives you about 120.
Okay.
About 120 per session. Yeah. And if you do require a professional care associate to supplement the care at home, to support the ADL, for example, then the cost may actually then add up to an additional 2,007 or 2,000 plus thereabouts, on a monthly basis. If you're caring for someone who requires 2 persons to actually assist.
Okay.
Yeah, right. For the showering, the feeding, for example, then having a domestic helper at home will not be sufficient.
Okay.
Then you get in a professional caregiver to supplement the care and to support with the simple ADLs.
Okay. Yeah. Right. And then we talk about nursing home. So this is, assuming that the person needs, 24/7 round the clock care. How much would that typically cost in Singapore?
Yeah. So for most nursing homes, the cost depends on the level of care and also the preference on the room type.
Okay.
Yeah. So if you're talking about a shared room environment, then the cost would start from around 3,000 plus a month. Yeah. But if we are looking for a private room, right, then that would go up to around $6,000 to $8,000 a month.
Right. And of course, I think that's where government subsidies are also can come in to help. I think in Singapore, we have CareShield Life. So this is a long-term care insurance scheme that has been introduced by the government. It replaced the old Elder Shield. So before that, we used to have Elder Shield, but if you're my age or younger, we are all enrolled under the CareShield Life, and it's compulsory. And I think it's a good thing. And let me explain why. Because I think I was in some of the, I think when MOH wanted to see if, the old Elder Shield care needs to be evolved, naturally, most people felt like the payouts amount were too low. So I think in the old Elder Shield, 400 is like, I think $400 a month. With CareShield Life, it's a little bit better because firstly, payouts are lifelong. So as long as you hit the criteria of 3 out of 6 ADLs, you get a payout for life as long as you need it. That's the first thing. Secondly, which I think is also good, payout is also higher. I think it's $662 as of 2025. And just to be clear, this will increase over time, which I think also makes sense because of inflation as well. But the question that I think a lot of people do still ask is they look at an amount like $662 and then, maybe they compare it to some of the numbers we were talking about earlier, and they might feel, hey, $662 is not even enough to hire a domestic helper, right? So then the question becomes, CareShield Life is good, but is it enough? What are some of the financial consideration do families have when they, need some of these services?
Well, I mean, firstly, we are really well looked after, in Singapore.
I think we are,
And honestly, the nursing home fees, be it home care, or nursing homes, or you would also have your medical consumables and other costs, that you actually have to pay for, when you're caring for someone with long-term care needs, right? And that can actually run to a couple of thousands a month.
Yep.
Yeah, and then there is a gap, right, in terms of how you're going to supplement, even if you utilize your CareShield Life payout. Yeah. And I would think CareShield Life as really the base, and the foundation. Yeah. And the role of CareShield Life is that it ensures that no one is actually left without a safety net.
Yeah. At least it provides the basic coverage so that everyone has it.
Yes.
But whether it's enough or not would be a very subjective thing for some individuals, right?
Yeah, that's right. And then with the right planning, right, just like how you take your health supplements, so you have CareShield Life, and then through supplements and various other plans, you top up your own savings and family support, then family members can actually then tap on that to make your long-term care more affordable, and also sustainable in the long run.
I just want to introduce, there is things such as CareShield Life supplement. So it's quite similar to the old Elder Shield. We have Elder Shield supplement. We also had CareShield Life, and then we have CareShield Life supplement. So these are typically MediSave approved supplementary plans, which means it's optional, but you can use your MediSave to pay for the premiums. And I think the criteria here is, and I think this is very important because a lot of people also feel quite strong. I mean, at least from some of the people I talk to, they feel very strongly about needing 3 ADLs before they can even claim from CareShield Life or Elder Shield, because a lot of people feel like, when we talk about the 6 ADLs, 3 feels like a lot, because if I can't even do one of it, like for example, if I can't feed myself, I think that's already a big concern for most families, right? Let alone having to meet 3 ADLs before we even qualify for CareShield Life. So I think with some of these supplement plan, we can actually allow for payout to start. So the Great CareShield is a CareShield Life supplement plan from Great Eastern, and it's a MediSave approved. Payout can start from just 1 ADL. So I think that's kind of addresses the question that some people have, which is, do I really need to wait for 3 ADLs before I can make a claim? Obviously, the other thing is higher monthly benefits as well, right? So you can opt for a greater payout so that, tailored to what you think is more necessary should one of these ADLs happen as well. So this could be 50% of monthly benefits payable upon the inability to perform 1 ADL, and then it goes up to 100% of monthly benefits payable if we can't perform at least 2 ADL. So obviously the amount can be higher. There's also other benefits such as dependent care benefits that can be paid upon also if we can't do some of these ADLs. So I think there's always options available. The good thing I always feel is that it's MediSave approved, which means that I don't have to come up with cash. I can just use my MediSave savings and it pays for some of this insurance plan that I might also need in the event of a long-term disability.
I think that's really good, and it's also important for family members to understand how these schemes and supplements work as well, so that they can make the decisions early. Right, and when the time comes, then you can focus on caring for their loved ones.
Yep.
Yeah, rather than worrying about whether they have enough to cover even the basic care needs.
I think quite often when I also think about long-term disability, right, I'm actually not thinking about myself, even though I'm in my 30s. Right, I'm actually thinking about my parents potentially needing it. I'm just curious, how prepared should I be for that kind of risk? Which means I'm still young, but I need the support.
My personal thoughts are we definitely do not want to get caught by surprise. Yeah, we wouldn't know, when a health episode hits us, right? Unless you are really free of all, the chronic diseases, you have a perfect lifestyle. But no one has a perfect lifestyle.
Even then, an accident can just
happen. An accident can happen as well, right? But the last thing you want is that when you yourself, are requiring care and you are the primary sole breadwinner of the family, for example, right? Then that's where you will hit a family really, really hard.
Just thinking about it just makes me like, I don't even want to think about it.
But even when, let's say you are, you and your partner both are working, but you have young kids that you have to raise, you have grandparents, or parents to look after, right? And it hits either one of you. You will hit with the income loss, right? And then your children are still young. Yeah. How is your wife, or how am I going to be looking after my husband? Our lifestyle, financial considerations, all these responsibilities are actually really being affected. Yeah.
I always tell my wife that I think physically and emotionally, I cannot imagine if this happened, how we'll feel, but the one thing we can worry about or take care about is financially, at least just to make sure that we're in a position where financially life can go on as normally as it possibly can.
Yes.
Even though physically and emotionally, maybe no life will never be the same again, right? I think that's just the only thing we can always tell her about this.
Yeah, and it would be, while we are preparing, for such situation, then that's also then how we care, carry our responsibility for the family.
And I think as Singapore becomes an aging population, as we are all very well aware of that, I feel like we are reminded of that every National Day rally. How's the demand for elder care, evolving in Singapore? Do you see like greater and greater demand each year?
Yeah, I mean, we do observe that the demand for elder care, and long-term disability and support services in Singapore rising. Right, and family members are really feeling it firsthand. By 2026, right, we know that more than 1 in 5 Singaporeans will actually be age 65. And above. And by 2030, that's coming really soon, right? It's gonna be 1 in 4. Yeah, and that creates really a pressure and demand, for more elder care services, right? Especially when many of us will really live longer.
Yeah.
Right? We have better healthcare.
I mean, that's a good thing.
Right? Yeah, and...
But it also means that we will be around for a longer period of time.
So quality of life is important.
Yes.
Right?
You don't want to... I mean, sure, everybody wants to live long, but you don't want to spend your last 10, 20 years, in poor health or needing long-term care, because that's not really how, retirement should be enjoyed, right?
Yeah, but when the need comes, then the support will be there.
Yeah, and I also think we all know this, right? But the population gets older, there's also lesser younger people to also take care of the older people.
Yes.
So if you're a married couple and you have kids, you might have up to 4 parents-in-law to take care of, and we all want to do the best for our parents, but I can just imagine, taking care of 4 parents, your children, your job, there's a lot of like physical and mental energy required.
So you see the accessibility to care and the services have really evolved over the years, and it's a lot more comprehensive right now. Yeah, where family members can really consider various options, from home care, daycare, senior care center. There's senior activity centers, to support the aging in place as well, residential care and assisted living.
And maybe just one final question. What are some practical advice you think working adults can take if they want to take small but practical steps towards preparing for long-term disability, either for themselves or their family?
First would be then to prevent.
Okay,
I think prevention is always the best cure,
Yep.
right? So prevent when you can, because many causes of disabilities like stroke also arising out of chronic diseases, diabetes, your heart disease, and they are also often linked to your lifestyle as well. So simple habits like get your regular exercise, eat well, right? Healthy living, and annual health screenings really go a long way in reducing the risk. And secondly would be to then really plan ahead. Also protect yourself, with the right safety nets. CareShield Life provides a foundation, but we can also consider other supplements, and insurance options, for example, right, to strengthen our coverage. Yeah, it's definitely worth setting aside an emergency fund as well, right? The earlier we start, then the more affordable and manageable it would be when you require care. But what's also important, is then for us to plan ahead, right? To have honest family conversations about care, your preferences, the responsibilities, what are we going to do when this happens and when that happens, right? Who's going to step in as a caregiver? What kind of support would be required? And these conversations aren't always easy. And lastly, and what's really important to always remember to self-care. While we care for others, we also need to look after ourselves. And a healthy, supported caregiver can really go much longer way, when we're caring for our loved ones.
Thank you, Hui Ming, for sharing with us your insights on long-term disability on the DollarsAndSense podcast.
Right. Thanks, team. Thanks for having me here.
Yeah, and for those of you who are watching this episode, we hope you have found this discussion useful, and hopefully there's some insights that you can help to better prevent and plan ahead for your own healthcare needs. Let us know your thoughts on this topic, whether you're watching this on YouTube or listening to this on Spotify. We'll see you again.